Thought TB was a disease of the past? Well, think again. Over 1/3 of the world's population is infected with tuberculosis. Hello and welcome to this edition of Health, which comes to you from a home for the homeless in the heart of Paris, where doctors are trying to stamp out TB before it really takes root. TB is contagious and spreads through the air, and as you'll see, we're not all equal when it comes to catching the disease. Also coming up in this edition, you'll see that the whooping cough is making a comeback, not so much a problem for adults, but for the infants they could pass it on to. Hundreds of thousands of babies still die from it every year. And finally, according to Oxfam, one woman dies every 30 minutes due to pregnancy or childbirth in Afghanistan. We'll be bringing you to one rural village where bearing a baby is greeted not with joy, but fear. We'll be looking at all this and more, but first here's some other news in brief.
Able to see through his tongue. A British soldier blinded by a grenade in Iraq has a sense of vision once again, with a device that transforms light images into signals. A camera in his sunglasses sends images to an electronic chip placed on his tongue. The chip sends pulses to his brain, and different signals allow him to visualise his surroundings. New York City officials have agreed to pay over $650 million to thousands of rescue and cleanup workers in the September 11th attacks. The settlement would compensate more than 10,000 plaintiffs who say they were made sick by dust at the Ground Zero site.
Globally, TB cases are on the increase, notably in countries across Africa and Southeast Asia. And while here in Europe the number of people infected dropped sharply after the 1950s, the illness hasn't gone away. If untreated, somebody suffering from tuberculosis would pass it on to an average 10 to 15 people within the year. And so doctors are trying to take control. Pascal Legros in white is part of a medical team that crisscrosses Paris, providing free clinics to keep a check on the life and breath of people living in more precarious circumstances.
Come with me, we'll go to the X-ray van.
Greeting people at the door of this shelter for the homeless, she explains the process and accompanies her first patient of the evening to the mobile radiology unit parked outside. A quick X-ray is taken.
Okay, breathe in now. Fill your lungs with air. Okay, breathe out again. It's done. The X-ray's clean. You're good to go.
And the patient is told he will have the results within 24 hours. Indeed, the next morning, all the images taken are brought to a public medical centre and are read by Dr. Antoun, who looks for any abnormalities.
In the sector of the population that we would have seen last night, that's those who live in shelters or on the streets, we would have an average rate of finding TB in 1 in every 100 X-rays taken.
According to the WHO, in Europe there are some 49 new cases of TB declared every hour, almost 10 million annually around the world. A decline in socio-economic standards and, to a lesser extent, AIDS are said to contribute to the disease's resurgence in industrialised countries. When it takes hold, TB can take a long time to clear. This man has been confined to his hospital room for 3 months already. After weeks of feeling tired and a cough that grew worse, he was diagnosed with the illness.
It was strange to hear TB as a diagnosis, but the doctor quickly reassured me that thankfully, these days it's curable, that the road to recovery was long, but I'd get there.
His X-ray shows that the strain of the disease that he caught in Paris is a pretty severe one.
It's a hole in the lungs, because once TB gets in, it starts to eat away at the tissue. And, well, it leaves holes.
Tuberculosis, all but eradicated, hasn't gone away. And now, more and more antibiotic-resistant strains are developing, mainly because people interrupt their treatments. Well, we turn now to another disease which was all but eradicated in many countries around the world, but which is on the rise once again. Whooping cough is highly contagious. It hits between 30 and 15 million people every year. 90% of the cases occurred in third world countries, but in the Western world, people are also starting to be caught for breath.
This man coughed for nearly 2 months before going to the doctor. As a heavy smoker, he thought it was because of cigarettes, but his health kept deteriorating.
I thought I had bronchitis. I started having respiratory problems, especially at night time when I was lying down. In the end, I had to go to the doctors because I couldn't sleep.
Blood tests show that he's got whooping cough, an infection of the respiratory tract, the sinuses, the pharynx and the larynx, which allow the air to travel to the lungs. The disease was thought to have been eradicated, but it seems to be coming back, mostly because few people get vaccinated for it. Whooping cough is easily treated amongst adults, but it can be fatal for children. In France, nearly a dozen babies die of it every year. According to the World Health Organization, the infection kills some 300,000 people across the planet. 90% of the cases are in developing countries, in people who are not vaccinated and who are often already suffering from malnutrition.
A woman dies every minute due to complications with childbirth or pregnancy. That's the shocking figure being put forward by Oxfam and other NGOs who are sounding the alarm as to what they see as a lack of progress in bringing proper healthcare to women around the world. One of the countries with the highest level of maternal mortality is Afghanistan.
Life has changed little over centuries here in the remote rural village of Tutblok. Tucked away in the mountainous region of Badakhshan, the settlement is totally cut off from the outside world. There is no electricity, no running water, not even a proper road. The provincial capital is a 3-hour car ride away, then a 4-hour donkey ride, where cars can no longer pass. But for this area's rural poor, even a donkey is a luxury. A trip to the provincial hospital can take 2 days, and for many, that is too long. The lack of basic services here contributes to Afghanistan's shockingly high death rate of women during childbirth. The NGO Oxfam estimates 1 Afghan woman dies every 30 minutes due to childbirth or complications with a pregnancy. The statistics are even more dramatic in isolated areas like this.
I'm very worried. I've already lost one wife, and I have paid a lot of money for this one. I don't know what I'll do if she dies.
No foreign aid has made it to Tutblok. Oxfam has criticised the international effort to help the poor in Afghanistan. 40% of Afghans still live below the poverty line. If a woman and child survive the birth, lack of healthcare means they are still incredibly vulnerable. This man's daughter died when she was 1.
She was so skinny she couldn't talk or say anything. She could barely open her eyes, and late one night she just died. Billions of dollars have come to Afghanistan, but none of it here.
Oxfam says the US military budget here is about $98 million per day. In comparison, the aid budget from all international donors combined is less than $7 million each day.
Well, we end this show now with a strange but true, tightly tied to that last report. You've just seen that in Afghanistan, giving birth can be a dangerous business, especially in rural areas where there's a lack of resources. More surprising, however, is the latest report from Amnesty International, which strikes out at the United States. More than 2 women die every day, it says, because of complications of pregnancy or childbirth. Around half of these deaths could be prevented if quality care was made available to all women. The report noted that the likelihood of a woman dying in childbirth in the US is 5 times higher than it is in Greece. Well, it's on that note that we're going to have to leave it for this week. A big thanks to everyone who worked on it, notably our producer, Young Jim. Thanks also to you at home for having watched it. Have a good week, and I'll see you again next time.